We have a ketogenic diet clinic for our patients with epilepsy. The clinic is designed to offer dietary treatments to patients with epilepsy. This is considered one of the 4 ways we have to treat epilepsy, and those are medications, epilepsy surgery, neurostimulation, like the vagal nerve stimulator, and then the diet.
The ketogenic diet is an important part of treatments for patients with seizures that are difficult to control. There's this misconception by many people that if you just give a little bit of oral medication, you can stop a seizure. That isn't always the case. There are some patients whom, even despite aggressive management with medication, their seizures still do not stop. And you're basically faced with a choice. You can give a patient more medication that has side effects and risk with it, or you can try to control their seizures with a dietary regimen. Well, I may have to do both, but if I can use a dietary regimen to help augment the treatment for seizures, why wouldn't I give that a shot? The ketogenic diet has been proven to be safe. We come up with a regimen and plan for the patient based on their individual needs.
The first appointment we meet with a prospective patient for over an hour and a half. We explain how the diet works. What you do with the diet is that you reduce the amount of carbohydrate and sugar that you give to your body, and instead the body is forced to use fat for fuel. By doing so, it produces a number of ketone bodies, hence the name ketogenic. We provide them with recipes, we provide them with lists of food choices.
We have a list that it's called the stoplight tool, just like a stoplight you would see out in traffic. And the green section has all our foods that are, this is a go. These are okay on the ketogenic diet. You don't even really have to measure them because they're all carb-free. And then our yellow section gets into the foods that have maybe a little bit of carb. So most of our vegetables have some carb in them, like broccoli or peppers. And then our red section usually has those things like breads, pastas, and all our sugary items that we have to avoid on the ketogenic diet. So I always tell patients, keep that with you, because that's a great tool when you just start the diet to look and say, I know that this is something I can or I cannot have.
I've never really been good at keeping track for myself, like on a diet or anything like that. So having a kind of support system with it gave me the confidence that I could stick with it, and that it was also going to not hurt me, that I was going to do it properly.
I'll usually have some quick breakfast, protein milk or something like that in the morning, or eggs and cheese, and I usually have a salad of some sort. It's amazing with family. We adapt it quite a bit so that we can still eat as a family. And actually they love a lot of the food I end up making anyway, so it works really well as a family.
I think doing the ketogenic diet or the modified Atkins diet, which is the modality that we use for most adults, doesn't necessarily have to be more work. Some of the foods that you eat in a modified Atkins diet are foods that your family will consume as well. The ketogenic diet has also some side effects. A couple of them can be potentially beneficial, the first one being weight loss, and a lot of patients lose weight on the diet. The second side effect that could be viewed as positive is that most patients feel more active, have more energy, they feel less foggy, they can concentrate better.
I feel sharper, so even just mentally sharper. I can focus better, sleeping better, and that might be because I was able to go off some medication because of it as well.
For my entire life, I had temper issues, anger issues, just short fuse completely, and now I have none of that. Temper and anger are gone, and that's part of my mental clarity, I think, is that part of my brain is silent now.
Although we're not sure of the exact mechanism, there's something happening that's just clearing everything in the brain and making it easier for them to function on a daily basis.
The diet has some other side effects, and one of them is constipation, especially if patients don't eat enough fiber and vegetables. The other one is gastroesophageal reflux disease. That's relatively easy to treat. Overall, the diet doesn't have any other major side effects.
Some things that we routinely monitor would be our lipid levels, and say if there's an increase in total cholesterol or triglycerides, that's where Dr. Tanner and myself can step in and say, what kind of fats are you choosing? Are you making sure that you're getting a balance? Because we tend to see people go a little bit crazy with their fats at first and, you know, pile on the heavy cream and butter, but we want them to eat those fatty fish too. We want them to eat plant-based oils, avocados, nuts and seeds. So we want them to get a good balance of those fats. So that's something that we definitely monitor, are their lipid levels.
We usually do labs at the first visit and repeat them every 3 months, and usually 6 or 9 months, and then on a yearly basis after that. The diet is usually tried for 2 to 3 years. If children are seizure-free, then the diet is slowly tapered and discontinued. For adults, it's been really different. Many of these adults, if they're driving, if they regain independence, if they manage to reduce their medications, oftentimes they wish to stay. And for a lot of patients, it's a change in lifestyle, and they tend to remain more in the diet long-term than children.
If I were to summarize how to conceptualize a ketogenic diet, I would say here at Mercy Health St. Mary's, we have all these pieces. Now we have this last piece to help bring it all together to control seizures.
I thought this was something we ought to do for our patients. We want the best for them, and providing an alternative that is easy for the patients to do, that only alters how they shop and cook, I thought was a really simple way to help them.
The ketogenic diet, it's not only controlling their seizures or helping to reduce them, but it's changing their lives, and they feel so much better in the fact that they're able to go without their medications or reduce those medications. We're really changing lives. And with diet, I think that that's the future right there.